Welcome to Cup of Jess, where the coffee's hot, the truth is hotter, and we're spilling all the real, raw business moves no one talks about. No fluff, just facts. Let's get into it. Welcome back to A Cup of Jess. We're excited to be here, especially today because for me, I started my running journey in 2025, and I'm excited to introduce Dr. Chavez, which she is a physical therapist and also she is from Houston, and you have been helping me through this journey. So, Dr. Chavez, introduce yourself, full name, and how is it that you got into physical therapy?
Yeah, so I'm Dr. Chavez. I'm a physical therapist, as Jasenia said, but I'm also the founder of Route to Recovery, which is a physical therapy practice in which we help mothers, runners, athletes all over Houston to overcome their pain and to be able to achieve their goals.
That's amazing. And that's something that I love what you do because whenever I started my journey as the running part, and I honestly I've always been like in my mind has always been like, oh, I'm not a runner, I can't run. They in the beginning whenever I was little, they would tell me, "Oh, but you have flat feet, you can't run." And then little by little I started running and I became better
Mhm.
and I was like, this is amazing. But then your body takes a toll afterwards.
Exactly.
So I did, have an appointment with you. You were able to help me out and give me that guidance
Mhm.
of, just making sure that I'm doing the right stretches, that I'm taking care of my body
Mhm.
and all that good stuff. So tell us a little bit about how you got into physical therapist.
So yeah, I got into physical therapy because a little bit of my story is that I used to be a soccer player. I live, breathe, and live soccer, and my dream was to be a professional soccer player.
Okay.
But in high school, I had an injury, my ACL tore.
Ooh.
So after that, I had to go through surgery, and then after that, I had to get physical therapy. At the time, though, I was just going through the motions. I didn't know that that's what I wanted to do as a career. But when I got to college is when I had to pick a major. And I was like, wait a second. But I wanted to be a professional soccer player. This is not,
Right.
the path that I thought I was going to take. So I had to make a choice and a big decision as to what my major was going to be from there. And that's what led me to physical therapy because I thought about my own journey.
That is great. Honestly, that's something that we don't think about, right? Until it happens to you. And it's funny because I used to work at a with an orthopedic surgeon. So you mentioned ACL, the ligaments and all
Mm-hmm.
this, or broken bones,
Mm-hmm.
and that's something that you have to. Even though it might not happen to you, you have to be it's preventative, right? Like
Mm-hmm.
the right stretches and things like that. And that's something that I learned as being in the field, but also what you advise. So tell us a little bit about your background. Parents, first generation, were you the
Yes.
first one to graduate?
That was the other thing. So I was a first generation to go to college. So my parents were just proud that I was in college. They didn't push me to become a doctor or a lawyer. They were just very proud of me getting to that point. And so again, the decision of what I wanted to become fell all on me, right? And then a little bit more, as soon as I graduated and I became a physical therapist, I actually started working in a hospital system. And through that experience, I was treating people and I enjoyed being a physical therapist in that field. But what I realized is that a lot of the injuries, like you mentioned, could have had been prevented.
Correct.
And so that's what led me to Route to Recovery now, where we do a lot more preventative approaches. Because I myself, I am not a runner. But like you said, if you start to train and get out there, your body will work with you and you will start to get better at it.
No, absolutely. And I am so excited of the movement you're also doing with the community.
Hmm.
I know you started a running group that I know I am supposed to be going to, but I keep not being able to make it, but I promise I'm going to make it. I know this week the weather was a little crazy, but I am loving that impact you're doing. So when did you decide or what obviously you worked in the health system, but then you started your own business.
Yes.
And when did you decide to say, "Hey, I'm out. I'm going to start my own company"? What made you decide that Houston needed route to recovery?
Yeah, so that was a major decision. I worked in the hospital system for 8 years, but after 5 years of being a physical therapist is when I started to feel a little bit different. Like I didn't belong in that setting, not because it was wrong or anything. It was just like I wanted something different. I wanted something more than what I could offer in that type of setting. So that's when the vision started to grow. I didn't think it was going to become a business. I was just like, I need to do something else. um, but then little by little, I was like, okay, this is the people that I need to help. And again, like we can fight a lot of these chronic conditions that I'm seeing, including not just physical pain, but like conditions such as diabetes, high blood pressure. All of those things can be prevented by taking care of yourself, by going
Correct.
for a walk, by going for a run, in addition to those things. So it wasn't until 2023, so it's been 2 years, that I finally decided, hey, I can't continue to grow route to recovery unless I leave this other full time job.
Correct.
And it was scary,
I bet.
to say the least.
It's like you have to take a leap of faith. That is one of the biggest fears, right? Because
Hmm.
you fear of failure.
Hmm.
But honestly, for me, I've learned that it's not failure. It's either a mistake or anything that you have, like any negative comment or feedback is a lesson for you to
Hmm.
learn as a business owner, as your profession, right? So um I know that, in our communities and our cultures, we don't believe about like going to exercise, and we
Hmm.
like the cafe con pan and everything. So
Exactly.
I mean, this is powerful because you're not only teaching people to, hey, preventative side, but for them to start moving. And that's something that I always used to tell my grandma. And I'm like, grandma, like just do some exercises in the couch, or in the mornings and
Hmm.
things like that. And they don't believe in that. They're like, oh no, let me just rest. And like you said, diabetes is huge. And I believe that 30 at least 30 minutes a day walking,
Exactly.
it impacts your health.
Yeah, I tell my patients all the time, walking is so underrated. It comes with so many benefits. And the reason why the Run Club came about is because, again, the frustration from seeing our community suffer with these conditions that could have been prevented or that can be uh, improved upon, but people don't know that, our people don't know that. And so just giving them that extra push, like, hey, you don't have to be a runner to come out. You can come and just join, and the energy is going to make you want to go out there and walk and run. And it's been amazing to hear people or to get a text message from them and say, thank you so much, this is what I needed, I just needed that extra push. So people are out there going for runs now on their own.
Correct.
They're not waiting for me, so it was just that little push that they needed. And every week it has been amazing to see different people show up. It's not always the same people, it's like different people, because it takes some people time to think about it, or
Right.
maybe they're busy like you, right? So they're like, I can't make it, but I'll go next week.
Yes.
But you did show up to the turkey trot, which was
Yes, which I almost died. So
not.
I feel good that she was there during that run. So I just love not only that you're pushing us, but just the care that you give
Mhm.
your patients afterwards. You're always checking in, like, hey, how are you feeling? And what are three tips that you give athletes or anybody that is in sports right now, to that you're like, these are the top three tips that I give you as like to prevent an injury, right?
I would say people are probably going to be like, what? That's easy. But sleep good.
Okay.
Like, prioritize your sleep. Drink your water. I have a lot of athletes that don't drink enough water. They drink like 2 bottles of water per day. So drink at least half your body weight in ounces of water. And the other one is just to make sure that they warm up dynamically. A
Okay.
lot of people go out there and before any activity they stretch, which is what they used to think was good back then, but they've done.
Yeah, and I was gonna touch on that because I've heard two different like
Hmm.
things. Like one, no, you don't need stretch. You just
Warm
But
up.
then, or the other one is warm up.
Mhm.
So whenever you say warm up, is it stretches, kind of like start moving your
Yeah.
body?
So it could be a little bit of both, right? But I think based on the research, it's more of dynamically stretching. And what that means is just getting your heart rate up. So,
Right.
and then doing activities related to what you're about to do. So for running, you'll see us doing like high knees, butt kicks, jumping jacks, lunges, squats before the run. So we're
Mm-hmm.
already out of breath. But at the end of the day, like people have told me, hey, that was a great warm up. I actually didn't stop the whole way,
Oh,
or I
wow.
PR'd
Yeah.
this time. So they're breaking records, personal records each time that they're going. So it's been amazing
Awesome.
for me to see the impact. That is not just because it's based on the research. Because like you said, there's research for both sides all the time. There's always
Yes.
controversy. But when you see it firsthand, when you see the results firsthand, then you actually become more of a firm believer. And I can actually say that with more confidence. Like warm up
Yes.
dynamically and get your heart rate
So
going.
I have to ask you this because I do have soccer players at home. So I'm always telling them, my kids,
Yeah.
I'm like, you need to stretch, you need to drink your water. So now that they hear you, especially from a professional, hopefully they're like, okay, I have to do this,
Hmm.
right? So what are some stretches, or this apply to also like a soccer player?
Of course, this applies to everyone, basketball players, runners, soccer players, dancers. It applies to anyone that is out there moving. Even if you're just going out there for a walk, it makes a huge difference with you warming up. So, after the activity that you're doing is when we start to recommend the stretches. So, stretching your hamstring, stretching the quads, just pulling your leg back and holding that for a couple of seconds. So, that's when you would do more of the stretching to prevent a lot of the soreness that comes the next day.
Awesome. Well, thank you so much for sharing that. I also wanted to touch base. For me, as you know, we have an accounting firm. I do taxes, and I'm pretty much sitting down a lot of time, like
Yeah.
most of the day. And I know that you also focus on the pelvic health
Mm-hmm.
of the woman.
Yes.
So, and that's something that is very interesting
Mm-hmm.
because as community or Hispanics, I would want to say it is that we're very close-minded. But there's certain things that we need to do that helps our pelvic,
Mm-hmm.
especially if you're pregnant, you're trying to become pregnant, or you had kids and you're like, okay, the pelvis is not feeling the
E-
same no more.
Exactly.
Yeah. So tell us a little bit more about that.
I'm glad you brought that up. I wasn't sure how deep we were going into
No,
this,
we're gonna talk about it for
but this
sure.
is a topic that I'm super passionate about. There's still so much for me to learn. I never stop learning about the pelvic floor. But what I will tell everyone is that the pelvic floor, like issues in the pelvic floor, are not just coming from the hips.
Okay.
So when I see somebody, so some of the symptoms for pelvic floor are leakage. So if you're peeing, I mean, if you're coughing, sneezing, or laughing, you pee on yourself.
Okay.
If you're having pain with intercourse or inserting a tampon,
Okay.
constipation, excessive pressure in your inner thigh. So that means like your organs are falling out. So
Okay.
that's called prolapse. So those are some of the main ones. 1 in 3 women suffer with this.
Mm-hmm.
That's why it's very important for me to talk about this today. Um, so if someone is coming to me with those symptoms,
Right.
I don't just look at the pelvis or the hip.
Okay.
We talk about sleeping, nutrition, hydration. All of
Okay.
that plays a huge role. And not just that, I take a look at the woman or even the male, because the male can also have pelvic floor dysfunction from head to toe.
Gotcha. Okay, so but it's something that it could be an injury, or is it something that, well, obviously you already touched base on everything that, but you think where is it coming from the most? Like,
For the most part, it is coming from, after having a baby,
mm-hmm.
um, you know, while you're pregnant, your skin is stretching, your muscles are becoming weak, and then you have the baby, and everything just has to go back in place,
Right.
right? And a lot of times women don't get physical therapy or any kind of training afterwards, and then they go on and they have another baby, and it happens again, and then they have another baby and it happens again. So what's happening is everything is just getting more stretchy, which means it's getting more
Well,
weak.
I wish I would have known that. I have 3 kids, and now I'm like, if I laugh or cough, you already know. I'm just kidding.
No, it is. It's common, right? Like,
Or running, like that's something that it happens. But I know you have like certain exercise or equipment, right? Can you touch base on a little bit
y-
of that?
yeah, and that has been brought up in the run group. Like, oh, we're doing jumping jacks, and they're like, "Where's the restroom?" Right? And so I'm seeing that it's more common than I think. It's like
Yes,
right there in the family, friends. So
but we don't talk about it.
nobody
That's the
talks
thing,
about it, but
because they're like, oh, we don't need to talk about that, right? So yeah,
that's why I'm here, because I want people to start talking about it, to not be embarrassed. There's nothing to be embarrassed about. Like I said, it happens to 1 in 3 women. So in a group of three, one of them or even two of them can be suffering from it. So instead, like, share this message, talk to your friends about it, and have it be an open conversation while
right,
while you're drinking your coffee. It's just the same as if you were to have a headache
right.
or back pain. That's how common this should be.
Yes,
So we want to break that embarrassment. We want to break that, and we want to make sure that people know that there's hope out there for
right.
them to heal, right? So some of the things that we do is, well, we would start with the evaluation, right? And then based on the evaluation, a lot of times what I have learned is that women are going home and basically just doing Kegels because their
Yes.
doctor gave them a brochure and
Mm-hmm.
they're doing Kegels, but now the problem got worse. So I'm not here to say that Kegels are bad, but they're just not for everybody.
Got it.
And so it's our job to figure out why the Kegels made it worse, if that is what they've been doing. So what happens is that the pelvic floor can either be too tight from stress, because just as our shoulders get tensed up, the
Mm-hmm.
muscles in our pelvic floor can get tensed up.
Mm,
Just as when we clench our teeth, our pelvic floor
correct.
muscles get really tight. But if they're the other reason is they could also be too weak, right? So it's our job to figure out, are they too tight? Are they too weak? And where do we start? Now imagine you doing Kegels, but your pelvic floor muscles
I
are
might be
just
doing them right
too
now.
tight. Yeah. You,
Because it's like that. But and then you think about muscles and you're like, oh, it's just muscles, but there's some extra muscles in our body that we don't even think about
yeah,
or we don't know about.
they're everywhere, right?
Yes.
So imagine you're doing Kegels because that's what you were told to do,
Right.
but your pelvic floor muscles are already tense. So what are Kegels going to do? They're going to tighten the muscles even more and cause
Mm,
increased pressure in that area.
okay.
So when you sneeze, that causes increased pressure down here, and it pushes
Gotcha.
your bladder so that you pee more easily on yourself.
Oh, okay, okay. And then I know there's the exercise, but I've also seen at your location that you have some certain
Yes.
um what would you
Tools.
call tools, right? What would you call them? Tools? Okay,
Yes.
tools.
A lot of women, they walk in there and that's the first thing that they see, because again, I do it on purpose to spread awareness. That's
Correct.
basically why I do that. But I've had ladies be like, "Whoa, am I in the right place? Like, are these toys or what are these?"
Yes.
But they're called dilators
Okay.
and pelvic weights and then pelvic wand. So those, I don't use them a lot in clinic. Those are mainly for me to educate you guys
Okay.
and show you how to use it at home.
Gotcha.
And usually, for those, you do it like in a relaxed setting, with relaxing music, and you're basically massaging your pelvic floor if it is too tight,
Gotcha.
but
Okay,
in a
well,
relaxed setting. So you're not in pain, you're not hurting or anything. And little
yes.
by little, the pelvic floor muscles start to stretch and the
Mm.
pressure decreases. So then you no longer leak or have pain with intercourse.
Gotcha. So those are the things that you guys have to see that, or if you're feeling those type of symptoms, you already know who to reach out, and she can give you more advice on what to do. So,
But one
uh,
thing, they don't
yes.
have to wait till they have symptoms.
Oh, okay, okay.
So you can just come in and get an evaluation before the symptoms come about. So it could either be before having a baby, while you're pregnant, or even
That's good
after.
to know. Especially the ladies that are either already had a baby or having a baby,
Hmm.
and they just, you're already feeling so bad and you're like so much pain. And it's true. Like
Yeah.
whenever I was pregnant, I didn't even want to go walking to the store because or grocery store because I would feel like that pressure,
Mm-hmm.
and I didn't know. I thought it was normal,
Yeah.
and that's something that we don't know about,
It's
right? So
because it's so common, and I've had women come to my office and say, "Oh yeah, my daughter deals with that, but that's normal, right?" And I'm like, "No, that's not normal." So then they go and they educate their daughters, and then their
gotcha.
daughters educate their friends. So
No, that's great, and I love that awareness that you're bringing to the community. But how does do you how often do you have people come to you regarding that, or this is something that is just spreading?
yes, that's the thing. So I have seen a handful of people, I would say since 2023 in my office, because in the other place I wasn't treating that. So yeah, it has been a handful of people, and we have gotten good results
Hmm.
to the point where people are like, "Oh, I can run again, or I can have pain-free intimacy with my partner." So I even had a lady call me the marriage saver, lifesaver, something like that. Because she's like,
Really?
because what we're realizing is that a lot of times the other partner, the male, will think that there's something wrong with the woman's feelings towards them. And
Correct.
it's not that, it's just that due to a lack of education or understanding of the topic, then it causes tension in the marriage
Got
and a
it.
distance. So, yeah, it can lead to a lot
It
of
it can lead
things.
to that. I can see it for sure. And
Hmm.
that's something that we need to be aware of, right?
Exactly. So, to answer your question, it's been a handful of people and we've gotten good results. But I would love to see more people coming out and saying, "Hey, this is what I'm dealing with. And is this something that you can help me with?"
I
Because,
love
like
it.
I said, constipation is one of the symptoms. Who doesn't have constipation,
Yes.
right? And
Especially during the holidays, all this eating, like we need to just get it together.
yeah,
Yes. No, absolutely. And so just to finish up the topic of route to recovery, where do you see what legacy do you want to leave to the community?
well, that's a big one. I would say um, that, like, to stay active, to find something that you enjoy, because I have a lot of couples or people that come with different family members to my office and like,
Hmm.
well, I want them to do this, I want them to do that, but we have to like stop forcing that upon the other person,
Correct.
and allowing each individual person to find something, a hobby, a sport, or an activity that they love to do, so that they can actually stick to it.
And have that family bond, or
Hmm.
with your partner, or that way you guys can stay active and it's something normal,
Yeah.
right? To it's like going to church.
Hmm.
Like every family has their like going to church every Sunday. Why
Hmm.
can't we have that exercise activities as a normal as well in
Yeah,
our
like find
families?
something that you can enjoy with your family, right?
Correct.
And so
Correct.
I think that would be the legacy that I want people to know Route to Recovery as. Like, it's a fun family. Like, for the runs, I'm like, bring your kids. Don't leave them at home. Like, bring them with you. I know
Yes.
some women are like, no, you don't want my kid there, but I'm like, no, bring them. And I saw your son was at the
Yes, and
race.
I was going to tell you. So this first 5K race we did was with my son.
Mm-hmm.
And I mean in my mind it's like, "Oh, they're still little." Like you said, I don't even bring them because I'm like maybe they're going to be bored. But honestly, it just gives a different idea and perspective to my son as well. Like, "Oh, wow, like my mom is running, like now I have to keep up and make sure I'm even doing better like in practice and soccer and things like
Mm-hmm.
that." And it's just you have to lead by example. So
Mm-hmm.
that's something I even tell my mom because we're Salvadorian. We're all about eating. We're all
Mm-hmm.
about being in a setting of oh, it's good, we just descansa, like
Mm-hmm.
no, like, but now I'm like, mom, no, like I even got her some running shoes, like go in the morning, like we don't want to have that those situations,
Mm-hmm.
right? But I just love it.
And I love that you mentioned that, because my parents are on the route to recovery as well. So my parents, again, were Mexican, but my dad loves sweet bread. My mom was always cooking like gorditas, enchiladas, everything, right? So
Tamales.
we grew up with that. But now through route to recovery, we're all learning about the importance of wellness and taking care of ourselves. So my dad, 3 years ago, he did the first turkey trot in
Oh, really?
2022. Yeah, he did the first turkey trot, and that's when he realized, wow, I can do this. I can do 6 miles. He started to have some knee pain, and I told him, hey, Dad, I can take care of you, but you got to meet me halfway. You got to take care of yourself as well.
Right.
You're eating a lot of sweet bread. You got to cut down on it. And then my mom too, she was, because of stress, she holds a lot of tension in her neck and back. I was like, look, I can do this for you, but you also got to take care of yourself. So now both of them, you didn't get to meet them, but they were at the turkey trot afterwards. Now my dad's running half marathons, and my mom's working out daily, taking her
Wow.
supplements, protein, collagen, and they're doing amazing things. So again, through them, I find the confidence to be able to tell people that are over 50, like, it's not too late for you to
That's what I
take
was
care
going to
of
ask you.
yourself.
Like, how old are your parents? Because that is a big deal. Like,
Mhm.
I'm going to be showing this to my mom, be like, look, her parents are running half marathons
And
and things like that. But um, three fun facts that Dr. Chavez can share with us.
three fun facts. Where do we start? I guess I'm the oldest of four siblings.
Okay.
I have two dogs, Coco and Lala, and I am actually starting to love running. I never
I
thought I
think
would say that.
2025 has been a year of and it's funny because the running groups have like gotten bigger. Like even with yours, like you started with like your first running group was what?
I was so
Like,
surprised. It was like 20 people that showed
and
up.
it was your first running group, and that's amazing.
And it was never in the plan, but it was like, I think, a calling that I had to do for our community. When I saw how many people showed up and the kids that showed up, I was like, wow, we were in need of this.
Yes.
And so I just had to go out there. So now I have to be the one there every week.
The
And
pressure is on.
the pressure is on. I feel the pressure. Today we canceled it because of the weather, but now I'm like, should we put it back
I
on?
know, and it's such a wonderful day.
Hmm.
Yes, no, that's great. That's great. And I know that we spoke a lot about the physical therapy part and everything, but now share a little bit about being a business owner. I know we talked about, it's hard,
Hmm.
but what would be one advice that you would give a young kid that is starting, 19-year-old, just graduated, maybe they don't even know if they want to go to college or
Hmm.
start a business.
That's a good one. Yeah, because I didn't study business. I studied exercise and sports science.
Nobody taught you
And then
LLCs, accounting, and
I know.
financials, right?
And then after that, I went to PT school. I had no idea that I wanted to be in business. But now, being 5 years in the business world, I would say that the best advice that I could give is to invest in yourself on a personal level, like invest in growing as a person. So, taking care of yourself, finding an activity that you love. Don't just focus on the business because that will not grow the business. So, if you focus on yourself and you grow on a personal level, you will see the business grow. So, you're investing time into something that you like to do. So, to take some of the stress away, but also investing money in a business coach. I think that has been my biggest investment is a business coach because I
That is
can't do this
amazing.
by myself.
Exactly. And that's something that I always I'm being repetitive here in the podcast, but it's having a mentor.
A mentor, yeah.
And it's funny that you say that because our next guest is going to be a business coach.
Oh,
So I think if you
nice.
could, we'll get to introduce you. But that's amazing. I want to say thank you so much for your time. I
Hmm.
know you're busy. I know you have a lot of things going on, patience, business,
Hmm.
and like you said, you have to keep up with learning, right? New exercise,
Yeah.
so new techniques and all that stuff. So I do want to say thank you for being here.
Hmm.
I know that we have been communicating and in the business side as well, and then also in the physical therapy side. And I do want to say thank you as well because you are bringing this awareness to us, especially that either we're starting to run, we're starting our your the exercise, and not to be like scared, right? Like, because a lot of people, they're like, I don't want to go out, or I don't want to go to the gym because I just feel like like people don't understand me, but
Mm-hmm.
now not only they know that they can go exercise, but also there's physical therapists there to help you avoid any injury
I've
or
heard that a couple of times. Well, if I get hurt, you're going to take care of me. I'm like, well, yeah, of course, right? So I think, again, going back to the legacy that I want to leave is just giving people the confidence to go out and do something that they enjoy without the fear of getting hurt.
awesome. Well, thank you so much. And you already know, a cup of Jess. Thank you so much, Dr.
Thank you.
Chavez.
Thank you for having me.